Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor. And this is a video about a case where mitochondrial support seemed to be the missing piece of the puzzle. Anyone who's been following my videos on Instagram or Facebook or other media has probably noticed that I like talking about mitochondria and mitochondrial support, and that's because I've found it to be a really helpful tool in my practice to crack difficult cases or plateaued cases, and it just seems to be really helpful in a number of the patients that I see, at least many of whom are suffering from complex chronic illness. So this is a case where I started treating this patient for the first time maybe 8 years ago or so. It was quite a while ago. They presented with a number of different symptoms, but one of them was just really long-standing fatigue. The person had not felt good energy levels since probably like 15 or 20 years prior to seeing me. And at the time of presentation, the patient was around maybe 50 years of age, give or take. So like most of their adult life, they've been dealing with fatigue. And they'd come in to see me because they had been exposed to a heavy metal. They wanted to get some chelation therapy done to see if that would help them to feel better, because they had accumulated more symptoms over time. Since being exposed to the heavy metals, the energy levels were even worse. There were some pain issues, other inflammation issues. And so we started exploring some of those therapies and treatments, and sure enough, there were elevated levels of heavy metals. If memory serves, I believe lead was elevated, so we did some chelation therapy, and that seemed to help somewhat with overall levels of, it helped to reduce some inflammatory symptoms, but really didn't make a big difference with energy levels, unfortunately. We tried different types of adrenal support, so herbal combinations, including herbs like rhodiola and ashwagandha and Siberian ginseng and adrenal gland extract and things to that effect. Nothing seemed to help. The patient's blood work was totally normal, so there didn't seem to be any signs of anemia or B12 deficiency or other issues that, low thyroid function, that type of thing. And so we tried other things over the course of time. We worked with some low-dose immunotherapy. We tried some herbs to see if there might be some type of a persisting infection going on. We unfortunately couldn't do any testing for that because just there were financial limitations, and that is what it is. So we weren't able to do that. We did a genomic profile, so looking at the patient's predispositions around possible methylation issues or other issues around their biochemistry. And we worked with some things like methylfolate and pyridoxal 5-phosphate, which is the active hormone vitamin B6, because there seemed to be some SNPs with the patient's CBS gene. And we worked with a bunch of different things, and certain things helped along the way. The patient was chronically constipated. We got the constipation under control. Pain levels seemed to go down. Some of the musculoskeletal stuff went down, but the energy levels just really weren't budging, not notably at least. And so several months ago, the patient came back in to see me just, for a general check-in. At that point, they were kind of just at a bit of a maintenance protocol, coming in to see me maybe once every 6 to 12 months, depending on what was going on. And so I said, you know what, why don't we try this comprehensive mitochondrial support? Let's just see if it works for you. And so the patient started the protocol. So the comprehensive list of, the myriad things that are necessary for the mitochondria to function properly. I've talked about this in other videos. There's a video that talks about what's the pill count for this type of protocol. So if you're listening to this thinking oh my gosh, the patient was taking 30 bottles of things, no, we've got it pretty much distilled down into 2 formulas for kind of the core comprehensive mitochondrial support. So the patient started on those supplements, and about a month later, we had a follow-up chat, and energy levels were doing great, 8 or 9 out of 10, where 10 is good, which was really exciting. And so I thought, wonderful, stick with the protocol. I think it was a phone consult if memory serves. And so hung up the phone and thinking that's awesome, this is exciting. And then I just thinking I hope it sticks. I was thinking it would, because looking back at her case with 2020 hindsight, it was kind of a textbook mitochondrial dysfunction issue. And so I was quite optimistic that we'd see, sustained results, but just thinking just want to make sure it's not a placebo effect or something like that. So we had a follow-up 2 or 3 months later, and energy levels still 8 or 9 out of 10. Stamina is doing better through the day, not needing to crash, just doing a lot better. Followed up again just recently. This is probably about maybe 6 months or so into the protocol, still doing really well. And it looks like it's a sustained response, which is very, very exciting. So over the course of time, I've been accumulating more and more of these cases where either they were my patients previously, and we were working with different interventions, and either energy, brain fog, stamina, certain other symptoms just weren't getting fully on track or weren't really budging. They were plateaued or just having a hard time getting any traction from the get-go. And comprehensive mitochondrial support has been very helpful in cracking a number of those cases, and which is very exciting, I think, for the patient especially, but for me as well as a clinician, because it seems to be such a powerful tool that seems to be helping a lot of my patients in practice. So with this support, or with this comprehensive mitochondrial support, is something that I am lecturing on actually this coming Saturday through the Forum for Integrative Medicine conference. It's supposed to be held in Seattle. Unfortunately, given the pandemic that is upon us, that was changed, thankfully, to an online-only event. So thankfully, because we should be socially distancing, but also thankful because we don't have to miss out on the conference. So I was really excited to hear a bunch of my fellow presenters talk about their various topics, from Jill Krista talking about mold to Neil Nathan talking about mold. It was just announced that Dr. Klinghart's going to be talking about some research updates around COVID-19, and just hearing Dr. Klinghart speak is always a beneficial and a privilege because he's such a wealth of knowledge. Ben Lynch is speaking. There are others that are really notable speakers that are going to be sharing their knowledge. So I'm really, really excited to hear everybody's talk. So I'll be speaking about that. If you're not already registered for the TFIM as a clinician, it's only for clinicians, but if you're a clinician listening, you're not registered for TFIM, they might be recording the event. That hasn't been 100% established yet, so that may or may not be an option. But something that I'm in the process of putting together is a mitochondrial dysfunction training course. It's probably going to be, well, I'm a bit long-winded when I talk about these things, so it might be anywhere from 3 to 6 hours. I really don't know yet. I've got probably about 300 slides put together already for this training course. It's about 90% complete. There's just a few other rabbit holes I want to dive down to try to make it as complete as possible. But I'll be offering that through my website in the near future. And I'm actually just within the next couple of days going to be putting up on my website a sort of a pre-course. So just a covering some of the content for the full course. I'll be recording that just because so many people since my interview with the Better Health guy and me squawking a lot on social media, people, other clinicians keep asking me like, what's the protocol and all that, and it's like I'm sharing that what's in the comprehensive mitochondrial support. But at the end of the day, the results that a clinician is going to get or that patients are going to get with these treatments are really only going to be as good as the context within which they're prescribed. There are certainly cases where it's really not indicated. It's probably not going to help that much. It's not a panacea for fatigue and brain fog and issues across the board. It needs to be prescribed at the right time in the right context at the right dose. And so that's all the stuff I'm going to be talking about as much as I can at the conference coming up on Saturday. And then I'll be going into it in a lot of detail, like very, I would say, comprehensive detail with the training course that I am putting together. So kind of the pre-version of that will be available online through my website soon, and I'll post on Instagram and Facebook when it's raring to go. And then anyone who gets access to that pre-course, once the full course is up and running, they'll automatically get access to that too. So if anyone just doesn't want to wait the month or so for me to get the rest of the course put together, they can kind of get a pretty good dive into the material with that pre-course. That is all I'm going to say about that. I hope that information was useful.